Hi, I'm here with Doris today, and I just wanted to ask you how you are feeling today.
Very well.
Very well? And tell me a little bit about the symptoms that you had when you first came to see Dr. Tamura.
Well, my jaw would click, and I'd open it wide. It would come out of the socket. It was very uncomfortable, and I didn't know when that was going to happen. And it was very difficult eating, not sleeping well, and it was the clicking. There was clicking and grinding, but every time I would open my mouth wide enough, like even an orange, just take a slice of orange, I had to open my mouth wide enough that it dislocated, and then I'd have to get it back in, and very difficult chewing, and it just got out of control.
When your jaw dislocated, was there pain associated with that?
The first, on the clicking, yes. And then for a little while, and then I'd get it back in, and then it would be all right.
And how would you get it back in?
By pushing.
By just kind of wiggling your jaw back and forth?
Back. I could do it by myself. I didn't need my hands, but it would click out, and then I'd move it back to get it back in.
And how long had you been experiencing jaw problems?
Oh.
Was it years, or just days, or weeks, or months?
It was months.
Months.
I noticed it once when I took a bite and used my jaw as a leverage, and it clicked out, and that was, I didn't take care of it until, let's see, a few months ago. Then finally came in. I had to find out where I was going to go, and a lot of people didn't know what I was talking about, but I got the right dentist and got to the right place.
And how many doctors did you see regarding your jaw problem before you came and saw Dr. Tamura?
I saw two.
Two. You're a general dentist?
Yes.
And then an oral surgeon?
Yes.
Right. Okay. What do you remember about the K7 computer system that Dr. Tamura hooked you up to make your orthotic? You remember anything about that?
Oh, it was amazing, but then as he explained, I saw what was going on and could see, and then finally understood all the things I was doing.
And what about it was, you said it was amazing. What about it to you was amazing?
Like with a computer. And
looking at the muscles, looking at the way your jaw moved.
You could see everything, and then it showed the difference, and we compare things, and it was amazing. And
you also had complained about some ear problems.
Yes.
Prior to this, other than the jaw locking.
Yeah.
Tell us about the ear symptoms that you were experiencing.
Well, it was predominantly my right ear, and now that's gone.
What exactly was the symptom?
It was like I was wondering if it was from the swimming, but it was painful at night. It would be sore, not like an ache, but like a stiff muscle soreness.
In your ear?
In the ear. And it was painful.
Full ear, stuffy ear, itchy ear, congested ear, pressure in the ear?
More of a pressure ear. Just
pressure inside the ear?
Pressure ear, yeah. That was what was painful, because there was no itching or no water or anything.
And then, since you've been wearing the orthotic that Dr. Tamura made for you, how's the ear symptoms been?
There's no ear problem at all now.
Completely gone?
No pain at all. And I'm sleeping better.
What do you notice about your sleep that's different? Can you be specific?
Longer, and if I do wake up, I go back to sleep. Sometimes seniors do. You wake up and you don't go back to sleep. Now if I do wake up, I go back to sleep. And
so were you suffering from insomnia before, do you think?
It was a form of it, because I'd be tired in the daytime, and that's when the caffeine came in, and I don't do that now. I don't have to do that. But now it's a more solid sleep too. And
what was the story with the caffeine? What did you say about the caffeine?
Well, I would, after, when I'd be tired or something in the afternoon, I had something to go, I would go to caffeine, so I could, like, going out and playing bridge at night, I'd have caffeine before I go. Now I don't have to do that.
Wow, that's huge. That's wonderful.
And I love coffee, but I was using it as
a stimulant.
Yeah, it's a little energy booster.
And now you don't need to do that anymore.
No, I don't do that.
That's wonderful. And tell me about your experiences with wearing the orthotic. Obviously, you're wearing it now. Do you feel like it affects your speech or your ability to eat or function or in any way?
Sometimes on eating, but it depends on what I'm eating. Like if I eat, don't eat any nuts or anything, but nothing else, and the speech, you get used to it. And then the difficult part is explaining it to other people how it works, because I'm not.
So what do you say to other people when they ask you, what is that thing?
I said I dislocated my jaw, and this is helping it get back into place, and so it won't keep coming out. It was coming out so much. You want to know how I did it, and of course it was with a piece of chocolate.
And tell me about your how it's affecting your athletic performance. You're quite an athlete.
Yes, I played quite a few sports. I was a physical education major, a teacher and coach, and the stamina is better, and I just started doing some swimming, which I haven't done, but now I can't believe the laps that I'm doing. And I played in a paddle tennis tournament, and other people, the big part was other people were amazed how I played. And they said, it's been a long time since I played that well. I'm back to playing where I was playing when I was much younger. And I have a lot more endurance, that I have to be careful that I don't overdo it, because I feel so good and then end up pulling a muscle or something.
So be specific. What specific things do you notice? Like say for paddle tennis, what specifically do you notice that's different? Stamina is one thing.
Stamina, getting to the ball, the movement, and making that correct. The timing is much better now.
Timing?
Whereas, you know, like you always have, a lot of people have a backhand problem, just thinking, backhand, and now I can correct it, and it's the moving, it's the accuracy and the skill.
Okay. So it would be coordination maybe, or balance, or
coordination and balance. And you read where senior people are supposed to do more balance, and now the balance that I'm doing is much easier than what I do.
And have you been doing any light weightlifting or any kind of strength?
The weightlifting has gone really well. I think I have more energy on the weightlifting, doing more and longer when I get the time. I'm anxious. I haven't yet tried surfing. That's what I really want to try.
So what would your advice be to someone who has TMJ?
Well, I would definitely go to Dr. Tamura, because now you know. I mean, you don't want to look around and go this way. You go, you find out what it's all about, you experience the equipment, you see what's going on, and it's one-on-one. You're not seeing Dr. Tamura while there's another patient in the next cubicle or something. It was really, you get the information. That's the main thing, is the knowledge of what it is and how to handle it. And
the treatment, do you feel like the treatment works?
I'm very happy with it. I can see in a couple of months what's going on, just the weeks. As every week has been a progression.
Getting better and better every week.
Better and better every week.
Wonderful. Thank you very much.
Oh, you're welcome. Thank you.
Okay. Bye-bye.